Good day, everyone. Thanks for joining in for this session of the ALNAP Meeting 2021. My name is Filippo Minozzi and I work for the International Committee of the Red Cross as Analysis and Evidence Advisor, and I will be the host for this session. Today, we will discuss the challenges and opportunities of remote beneficiary management, a need that became more and more evident during the pandemic, but that actually applies to many contexts where we work during normal times. Today with me, we have the pleasure to have Joseph Oliveros, leading cash innovations at the International Federation of the Red Cross, Shahnaaz Parker, Analysis and Evidence Project Advisor at the International Committee of the Red Cross, Helen Campbell, Technical Platform Manager for Cash-Based Assistance at the British Red Cross, and finally, Mohammed Aklan, the ICRC Analysis and Evidence Officer based in Yemen. So said that, let's just deep dive into today's topic, remote management of affected people. Remote management of affected people means basically to look at addressing the challenges that humanitarian organizations like ours face in reaching and managing reaching beneficiaries and managing assistance to the affected people remotely. These challenges are security and access to art to reach places, for instance, but they have been further compounded by the pandemic, as you all know. So with this in mind, the idea is to find an innovative solution to minimize the exposure and the risk while still ensuring accountability and quality responses that are centered around the needs and the capability of affected people. Ultimately, the idea is to improve the quality of current operation that suffer from erratic access, and then also to try to offer a new possibility to assist people that we never actually managed to reach. To say that, I'd like to start by involving our panelists. I'd like to start with Joseph. Joseph, can you tell us a bit more about why the need for a human-centered approach to remote management should be explored?
Great, thank you so much, Filippo, and hello, everyone. It's a pleasure to join you in this discussion today. Maybe firstly, describing before talking about the remote, what are the traditional methods that we're currently doing? So the traditional methods in beneficiary management and assistance provision currently require physical and close proximity with affected communities, which is not always feasible, as we have seen in a COVID context. This is also difficult when communities are in hard to reach or very remote areas due to geographical barriers or impacts of disasters, crises, conflicts affecting access. The challenges that Filippo started to mention in terms of access, security, but also costs and efforts to get in these areas may complicate a response. Also, visiting people also assumes we know where they are. And in some cases, communities are unmapped. And so therefore, they are forgotten or left behind. And these were the findings of the IFRC's World Disaster Report from 2018. So remote methods, really what we're talking about are remote ways of doing targeting, registration, and verification of affected people. There are tools that could be used to employ, such as self-registration instead of house-to-house visits. There are also a lot of exploration on the use of digital IDs for which it could be used for remote verification and authentication. Additionally, there are also methods for remote assistance provision, such as the use of digital cash and remote monitoring to ensure the quality of programs. Using remote methods is not new. We've had some of our Red Cross, Red Crescent national societies use such methods even before the COVID-19 pandemic. But we did see that those who were familiar with these methods and have prepared themselves to employ such methods and tools were able to adapt and respond to the pandemic much quicker. We just want to make sure also to note that using remote methods does not mean less interaction with communities, but rather optimizing when it is absolutely necessary and feasible for face-to-face interactions, and relying on data, digital, and innovative means to continue the engagement with communities, which is very important. Solutions for remote beneficiary management should also be very user-centric. We also have to take into account and mitigate the risks such as data protection, privacy, and security from the get-go.
Thank you very much, Joseph. Shahnaaz, I'm turning to you. Do you have any additional input from the ICRC? How did your organization adapt to the pandemic when confronted with the uncertainty? And has there been any disruption in the approach?
Yeah, I think, yes, Filippo, thank you so much. Like many other humanitarian organizations, the COVID-19 pandemic as a disruption added additional strain to the already existing contextual issues that Joseph has already mentioned above, such as proximity, or as he has mentioned, as well as access and the security lens. So the ICRC also then focused particularly on expanding on remote data collection tools and capacities, both internally and with the partners that we work with. And in some contexts like Yemen, we also then engage with third parties. So really adapting for a mixture of in-field activities and remote activities, looking mostly at telephonic means, where of course we still encounter connectivity problems. Also strengthening targeting practices, like what Joseph had highlighted in the areas of beneficiary targeting, reaching the right households remained a priority. And here is also where ICRC saw a need and has just concluded an ICRC targeting guidelines that we have published very recently. So we can also share that. And then also it just in terms of looking at the capacity to implement remote management, given the current resource constraints that we face and the sector as a whole, and given the lessons learned from remote data collection and methodologies for remote practices, they always slightly differ from the in-field or the face-to-face activities. So there was a need to look at exploring the challenges as well as the type of capacities that we needed to work on, not only within the ICRC, but also with the national societies and the third parties that you work with. And then, with the pandemic as our disruptor in this instance, you look at the inclusive community engagement for this process, and not only the inherent, where you don't have the face-to-face interaction, but also that uncertainty that comes with the changing environment that we saw last year, and the misinformation and the fear that communities have. So there was also a lot of emphasis that we put, for instance, on negotiating for access, but also the sharing of information on mitigation measures. So really focusing on that risk communication and community engagement throughout the programming in order to mitigate for this disruption and keep the programs moving as smoothly as possible.
All right. So yeah, you're telling us a bit of the theory here, but how does this translate into practice?
Okay, well, practically, adapting to the pandemic really required additional resources within delegations in terms of your personal protective equipment, internal organization, and the community awareness raising of COVID-19 mitigation measures, which I had just mentioned, and then also just adjusting the operations to make those, either if we are going to be going in remotely through partners, but even face-to-face interactions needed to become a lot more safer. So one way that we could adapt, and I think that so many other organizations had also taken this approach, was also global standard operating procedures, right, for mitigation measures and setting up the way that we interact. But what has to happen in practice is really that those operating procedures needed to be trickled down to the partner organizations, community groups, and the third parties. And those additional trainings, such as remote trainings, even on different platforms. So we have our, digital platforms that we can utilize, but even going to the messages, texts, things like this that you can then work with, especially in very remote areas. Just to really keep those spaces a lot safer. Then also the type of programming sometimes really needed to be assessed, especially when looking at what is the urgent community needs. So for instance, where food would be a priority, of course, now with this type of disruption, you also have healthcare costs becoming a big burden to the family. So maybe cash would be a more versatile intervention. So those are the type of practical considerations. And of course, with your remote monitoring needed to be scaled up quite a bit, because that face-to-face interaction with communities, really we saw less and less of that, given all the considerations. So assessments, and then also what we had done as an organization is to do a global survey, what we call the EcoSec Global Survey, to support delegations in reaching out to beneficiaries telephonically on their situation and what the impact of COVID-19 was on them. And thus we reached about 22 delegations. So yes, it was something that we could explore a little bit more. And then also just heavily still relying on the dialogue with community leaders and key informants, and also just trying to get that the message across and keep beneficiaries as informed as they would be with traditional methods, and trying to close that gap. So using social media platforms and also traditional radios, etc., to get the message and the dissemination out there. Yes.
Thank you, Shahnaaz. So I know also the British Red Cross has been working on this in the UK recently. Helen, can you tell us a bit more about that?
Hi everyone. Yes, so our experience has been very similar to what Joseph and Shahnaaz have already talked about. So we established a hardship fund at the outset of the pandemic to help people in the UK who were suffering from financial hardship that had been caused by the pandemic. So as has already been mentioned, this approach was established to give us more versatility and to enable us to provide a faster response to communities across the country. So because the access was hard due to the lockdowns, and because the socio-economic vulnerability caused by COVID meant working with a much wider range of service users than we would normally work with, we decided to partner with local community organisations who we knew would already have the local relationships and therefore be able to identify and refer the most vulnerable people. And this also had the added benefit that because the programme was only designed to provide short-term cash support, if we did it through local partner organisations, then they would have a longer-term case working arrangement with the person being helped, and they would also know the identity of that person before they referred them. So the way we went about this was we worked with Red Rose, with the Red Rose platform, and we developed a customized version in which the partners could use a referral form to refer people to us. We would then check that referral to make sure it meets our eligibility criteria, and we would also do things like checking for duplicate referrals. And then assuming that all passed okay, then we would post a prepaid Visa card to the beneficiary. Of course, then the next thing we needed to do was make sure that the card did actually get to the correct person. So we needed to do a bit more verification. So the way we did that was that when the beneficiary was registered, we would register their mobile phone number, and we would then ask them to send a text message back to us using that phone containing their date of birth and the ID number of the prepaid card. And if all that information matched, then Red Rose would automatically verify that the correct person had the card, and they would therefore activate the card. And we found that this approach of working through partners had multiple benefits, really, because it both helped the partners to be able to so it empowered the partners to be able to help their communities more, and also empowered the people who were being given the cash as well. So I think, just to echo what Shahnaaz said, the engagement with local community organisations was absolutely key to the success of this project.
All right. Can you give us a bit more details on how you do your targeting and selection of beneficiaries in this program?
Yeah, so we decided to restrict the fund to being available to people who needed short-term financial help due to the pandemic. And so it was people who couldn't afford the basics such as food, and people who didn't have access to any other form of income. And we then went a bit further and defined the at-risk groups that we wanted to target. So that this included, for example, people who don't have access to public funds, elderly people, people who are facing homeless, and survivors of gender-based violence. And then the other thing we did was we created a map-based vulnerability index, which used publicly available data sets on things like employment types, unemployment figures, health statistics, things like that, to help us identify the most vulnerable parts of the country as well, so that we were making sure that we were reaching both the most vulnerable types of people and reaching the most vulnerable parts of the country as well. And then finally, we used all that information to help us to select the most appropriate partners, so that we would make sure again that we were reaching all parts of the country and reaching the most vulnerable people.
All right. So you mentioned cash assistance, but if this was to be done through in-kind assistance, would that be feasible, or the logistic would just make it impossible?
So for the COVID pandemic, we tried to move away as much as possible from in-kind assistance due to the lockdowns, because obviously that made it much harder to get to people. So we replaced them where possible by things like the cash support that I've just talked about, and also supermarket vouchers. However, obviously there were some people that for various reasons couldn't leave their home, so we did still continue to provide in-kind shopping services as well. The verification for giving supermarket vouchers was slightly different. So we needed the beneficiary to show us some form of ID, which needed to be an official document containing their name and address. So to try and reduce the need for sending data, we tried to focus on using things like video calls such as Zoom or Teams or FaceTime, where the beneficiary could literally just show us the ID during the call. But in cases where that wasn't possible, we would need to ask them to send their ID by email or by SMS, so that we could verify their identity. But then we made sure, obviously, these were deleted straight after being checked.
All right. So the three of you mentioned community engagement. So I wanted to ask you a question. How do you ensure proximity with and accountability to the affected community when you're actually working remotely?
So I guess the main way we did that was through our the partners that we were working with. So we had hardship fund leads who were people working for British Red Cross across the country, and they would maintain a close working relationship with the partners. So they would have frequent calls with them to help them with any project issues and any questions. So I guess that was our main way of maintaining close contact with the communities. But then we also sent out surveys to all the beneficiaries who we helped and all the partners to ascertain the outcomes of the work that we'd done, to make sure that we were being accountable to those that we were helping.
All right, thank you very much, Helen. And this was in the UK, of course. But I wonder, like, how difficult this would be to be done in the field. Mohammed, I'm looking at you. Why don't you tell us about your work with the ICRC in Yemen?
Thank you very much, Filippo. Before, let me give me a brief about the ICRC operation in Yemen. The ICRC Yemen has been dealing with two authorities. As the authorities is still divided into North and the South, usually ICRC face constraints given the condition laid out by the authorities limiting access to communities. COVID-19 had further limited access, giving the uncertainty and fear that is associated by the pandemic. However, operational need is continued to increase, needing faster solution in order to help affected communities. I want to give an example about authorities providing predefined lists to organization and the needs to verify these lists communities meet that meet ICRC targeting criteria. To continue to reach households most affected and meeting the ICRC criteria according to the specific program. ECOSEC Yemen applied remote data collection option in conducting verification from the office by setting up trained staff to collect the data remotely. But remote data collection was, as the remote data collection was the only option, though it was not the ideal solution. As our activities are in a remote area where network coverage is not functional, and to overcome giving disruptions, our delegation utilized the third party to conduct the verification activities to ensure that the beneficiaries in the predefined list provided by the authorities are meeting the targeting criteria. Alongside utilizing third party to conduct the verification, the delegation also engaged the third party in monitoring activities, such as process monitoring, post distribution monitoring activities, and the post harvest monitoring activities. Yeah, the delegation is having discussion to engage the third party on assessment and community engagement activities in the future where the access concerns are considered. ICRC was able to over this disruption by the added value of utilizing local third party. Furthermore, we are working with the third party allow for increasing frequency of data collection, such as post-distribution monitoring and process monitoring activities. As the ICRC team arranging for the monitoring visit in the north usually take at least 1 month, the third party team are able to deploy much faster in 2 days to maximum 1 week. Another added value as the ICRC work together with the national society counterpart, coordination is needed to the with the third party to conduct the activities. The third party needs to have the necessary expertise to complement the ICRC work when ICRC is not present on the ground. Can you hear me?
Yes.
Yeah, there are some challenges for the ICRC when they use the third party to conduct the activities. Some monitoring activities require to be collected within specific time frame in order to be valid, which sometimes third party cannot perform this because of the delay of the clearance delay by the authorities. For example, process monitoring, post-distribution monitoring activities required to data collection for the post-distribution monitoring activities required to be, it should be between 2 weeks to 4 weeks after the distribution. But if there is a delay and the data was collected after this after 4 weeks, then the data is not valid for us. Another challenge is third-party service may have insufficiency in community engagement, which may affect the reputation of ICRC in the community. The mitigation measures to overcome this challenge are defining rules and responsibilities between the two parties before the activities, rules for and responsibilities for the community engagement and rules and responsibilities for the third party. Connecting with our team said, another disruptions was conducting activities during COVID-19 pandemic was not possible because the delegation didn't allow staff movement where we had to reach affected population through community engagement and receive their feedback via ICRC community call center unit. Yes, Philip.
Thank you, Mohammed. How do you ensure that the verification is done correctly?
What I'm saying in Yemen, in our context, the best solution to conduct the verification is through the third party with the support of the national society. There are steps to ensure that the verification done correctly. What we do is we train the third party and the national society where the criteria is well explained and its rule and its rules and responsibility is well communicated to the two parties. After that, there is a meeting between the national society and the third party before the activity to discuss the coordination purpose and the movement plan for the activities. I can give you an example here for one district that we conducted the distribution there is in Al-Wazi'iyah district. We deployed Prodigy and the national society to conduct the activity after we trained them and defined the rules and responsibilities for each party. Prodigy rule was to verify the households if they are meeting the criteria, and they are eligible for the ICRC assistance or not. When the household is verified, the Prodigy team provide the household the ICRC distribution card and take the fingerprints of the household as a proof of the delivery. The role of the national society here and the community members is to mobilize the community who are in the predefined list provided by the authorities, and conduct dissemination to community about the program goals and the verification. Here we ensure that the community understand the project from the dissemination. We ensure that the community understand the project, and also we ensure that the verification is done correctly.
But what level of digital literacy is required to make this work? I guess Yemen, we are talking about not the highest level of digital literacy. So I would just like to know from you what level is the minimum that we would require for that.
No, from my experience with the work with one of our partners, as I mentioned, Prodigy are our primary service provider. From our experience with them, the level of the digital literacy of the Prodigy is highly sufficient, as they have their own digital system to conduct various activities such as registration, verification, and monitoring activities. They also do analysis and reporting, dashboards, and so on. And the staff on the ground are trained on using this system. That's why we are receiving really good and quality.
What are, I guess when you work with a third party, there is always the data protection issue that comes to mind. So what are the mitigation measures that you use in that sense?
Yeah. During the tender, before we sign the agreement with the third party, usually data protection note is requested from the third party, and it is well studied to ensure that the ICRC data is only entitled to be used by the ICRC. Then we check their compatibility with the ICRC data protection procedures with the support of our technical department, like information management. When we both discuss and the clauses and the data process before signing the agreement to clarify the use of the information. However, we are now having a serious discussion with the third party to use as they are using their system. We are now having a serious discussion with them to use to see the possibility of the third party to use the ICRC data collection system, such as Device Magic. The purpose of this discussion is to ensure that the data is stored only in the ICRC system and not be reached or used or viewed by other stakeholders.
All right, thank you very much, Mohammed. It's very, very interesting the work you guys are doing in Yemen. Joseph, I'm back to you. Is there any additional experience from the IFRC that you would like to share with us today?
Great, thanks, Filippo. Yeah, it's really good to hear about the various different experiences from the British Red Cross and from Yemen. So really good to complement also what some of the national societies have done in this regard. So one very good example is from the Canadian Red Cross, where they have been using remote methods for a couple of years now. They've used it in response to wildfires, for instance, even before the pandemic, and also some domestic flooding in that area. But how they have used some of these remote methods is one around the use of remote registration via self-registration on either a web portal that they would activate on their website, and also having a phone or a hotline, where people could also request for assistance or to register. There's also the remote verification using third parties, but in these cases, the third parties, for instance, could be using a credit bureau, where you give some identification information and it checks to see whether or not you are that you're alive and that you are a real person, for instance. So some very basic checks in there to make sure that we're trying to minimize fraud and duplication of assistance. There's also facilities to verify using video calls with individuals to verify that they are the intended or targeted beneficiaries, which again, it's an extension of a door-to-door or face-to-face visit, but using technology. We have other national societies, for instance, the ones that have responded in the Caribbean, where they have used also COBO forms, which is typically what we would use on the normal household registration of beneficiaries, but making that be available again, either using a laptop or a computer by accessing the web, or through people's mobile phones, so that they could enter their own data directly into a simple form. And that gets reviewed by the National Society based on the criteria. There are also some other ways in which, if it's identification or getting a list. So I think it was mentioned around working with governments, for instance, to verify some of the list of individuals. We have a national society that have explored the use of social protection lists to make sure that the most vulnerable are identified and they could be cross-checked. Also, when we talk about remote, very hard to reach areas, particularly when certain areas are impacted by disasters and it causes geographical barriers, some of the national societies are exploring the potential for deploying drones to assess the areas, not necessarily to identify people, although there's been some topics in terms of, okay, would it be appropriate, ethical to also do identification of people using drones, but at minimum, it's they understand the steps in the process, whether or not it's using the self-registration forms. And I think one of the key things that we have identified is, how are we furthering inclusion in the methods that we are using? So in the case of where a national society might be opting for a web-based self-registration, for instance, the Canadian Red Cross is also offering facilities so that affected communities are able to interact using phones. So it's not exclusively only for those who have internet access, but those also who are able to communicate by calling a hotline. And there's also facilities, of course, to ensure that national staff and volunteers could be reached. And so therefore, really making sure that there's inclusivity using the methods that are being employed. The other piece, maybe in last point, is around the self-registration and how it also not only ensures that we empower the affected communities to provide the information and to request for the assistance that they need. Part of that, it's being able to communicate clearly what the targeting criteria being used are, and also providing a mechanism for them to share their feedback. Is the targeting criteria not clear enough? Are they confusing to some of the affected communities? And so therefore a dialogue and an opportunity for the humanitarian organization to address and adjust how they respond using remote methods.
All right, thank you very much, Joseph, for this very, very exciting and inspiring examples, and thanks to all of you for answering to my question. But I think I'm done asking my questions. I would like to actually start looking at the questions that have been coming in from our participants. Shahnaaz, can you have a read at them, and then we'll try to see if we can answer to them.
Great. Yes, I think the first question that we had was about the ICRC's M&E practices in field. So the ICRC usually doesn't have M&E specialists in country and relies on in-person monitoring by delegates. So protection is often tends to be prioritized. So maybe Filippo, if you can shed some light on this question, if I can leave that to you, and then we can take the other questions as they come.
Okay, yeah, this one it's very timely actually, because I mean, as an organization, we know that the demand for evidence in the sector in general is today higher than ever, and this is in the design of responses, the monitoring and evaluation of programs, as well as accountability and learning. So for us, as an organization with the multidisciplinary mandate, seeking to deliver a comprehensive support to communities that are affected by conflict or other situational violence, this basically requires an approach in which situations are assessed, needs are identified, responses are designed, implemented, but then also they are monitored with the involvement of different departments. Which includes also the protection department. The ICRC struggles to capture the impact of its work as an organization. I'm not going to lie to you on that. But we lack a culture and the capacity to effectively monitor what we do. But in turn, there are exceptions. What I'm trying to say is that there are exceptions in the institution because we have been moving towards better measuring outcomes, and to do that, you need to have a strong monitoring department. And the analysis and evidence team that was created in 2018 for the economic security unit is now being expanded to cover all the protection and essential services areas of work, because that's been considered as a best practice for the organization. So we have right now this initiative that is called outcome-based approach, that is to promote a more intentional and systemic outcome-based learning and evidence capacity. And the vision is really to improve the capacity of the ICRC protection and essential services division to monitor what we do and how we do it. And that will definitely contribute to increase the program quality, the accountability, the learning, and our capacity to work multidisciplinarily. Right now, we started in 4 people in 2018. Right now, we have 56 only for the economic security department, and as of January, as I was saying, this will be expanded to cover all other type of programs, including protection. So the segregation of duties will also be applied to those programs without leaving the delegates to do all the project cycle by themselves. I hope I answered the question.
Yes, thank you, Filippo. Then the second was also about the ICRC, just giving some concrete examples of how the ICRC has, how they have done remote monitoring and what have been some of the key challenges. Maybe if you guys will allow me, I will maybe just respond to this. So usually within the ICRC, we do remote data collection and monitoring as well through our partners, the National Society counterparts in the country, and this is really the strength within how we collect this information, and we do this together. We focus a lot on capacity building, and this is, I mean, it's been raised through the session so far, just some of the key challenges, of course, with for the ICRC but for the national society as well, within different contexts, is that contextually there are different capacities, whether it's technologically or understanding how to conduct monitoring activities. But this is something that that we do work on. Then, of course, Mohammed has highlighted third-party monitoring is one way in which a remote monitoring is conducted, and where you have multiple third-party monitoring service providers, you can then have checks and balances where if one does one activity, the other one can do another activity in order for us to check the accountability that exists in this space. Then, of course, you have the calls to key informants where communities are hard to reach, as was highlighted earlier on. It is something that we still do struggle with. In South Sudan, for example, there was a proposal that we could also invest a little bit more in resource mobilization for Tharayas, as an example, just to reach those hard to reach areas where community leaders could maybe have this resource, and we could then also have that connectivity and can strengthen it. So, of course, with some of the challenges is really the resource mobilization component for remote monitoring, is having those on the ground, having the sufficient not only capacity to collect information, but the means in which to do that in a timely way where, you know, your device magic, your Kobo Collect can be utilized efficiently. And then, of course, the telephonic surveys that we do is probably the main way that ICRC would reach out to assisted communities post distribution, but also while distributions are ongoing. So that immediate telephone call, and then of course the some of the challenges over there is really the mobile connectivity, the means for beneficiaries to have active mobile devices, even if they do have that. So we are very cognizant of you know, the cost that it also incurs for a beneficiary or an assisted community. And then, of course, we do collect information from beneficiaries by self-reporting, etc., or feedback that they give. So through community contact centers, and really trying to strengthen that hotline aspect of how we conduct this, where we put the burden back on the organization and not on the community themselves. Then there was one other question. Vivian, so maybe we could ask Mohammed just to take this. So how do you ensure that the third party is objective and not just reporting what they think you want to hear? How about we park that one and then we go on to the next question and we come back. So for Joseph, how do you ensure that data protection for digital data, and where technologies can't be used, so internet, drone usage, etc., how do you engage with communities?
Great, thank you so much for that question. As we mentioned, data protection has been one of the key things. Anything that we do with data and digital these days, the risks and mitigations around data protection, security, and privacy are things that we are prioritizing. There are a couple of different ways in which we could try to identify, first and foremost, what are the risks in terms of data protection. One is by conducting a data protection impact assessment. So it's a tool that is available. There are several templates that are available now. One really good that is also described quite a bit in detail is available in the ICRC Handbook on Data Protection. So we could provide you a link to that. But basically, a data protection impact assessment includes an analysis in terms of what are the data flows. Based on your process and how you're going to be conducting your work, what type of technologies are collecting data, what types of data, who are you going to be sharing this information with, particularly, so we're talking about third parties, what are their responsibilities, and if there are any risks of potential either misuse or unauthorized access in this flow on that data, then flag that and discuss that with a project team to see whether or not the approach and the use of the technology is appropriate. And is it balanced within the benefits that you wanted to expect or what you're expecting from the use of that technology itself? One very good example that we've currently done in one of our projects where we have done a DPIA and we have identified that one of our technology vendors that has to do with voice biometrics, for instance, we were not as confident that they were able to address the data protection issues that were flagged, and therefore from a project team perspective, we said that, okay, this is not a risk that we would like to, that we were able to take on as part of the project, and definitely not gone with that particular provider, and had to change actually our processes and data flows to ensure, first and foremost, that the protection of the beneficiaries was prioritized. The other key important thing is user consultations. So still going back to the communities, checking to see what their preferences are, and explaining how the project utilizing the various components of the technology is going to benefit them. And I think the key here is, what are the benefits for the communities rather than what are the benefits and efficiencies gained by the organization itself. So that's the type of change I think that we are seeing in terms of, having these discussions with communities. So it's no longer that we're prioritizing our interests as organizations, although, it is important to ensure accountability and quality of programming, but also making sure that we really also adhere to the principle of do no harm, and therefore having that level of engagement with the communities in terms of how we are using their data and what are their rights as well to the data that we're collecting from them. So these two methods, we have for cash and voucher assistance, we have just released the practical guidance, for instance, which could also be helpful for those who are employing more of the processes of using data and digital in a cash program. This could be a reference tool that might be useful also in your analysis. The second part of the question, in terms of what if the tech is not it cannot be used. How do you engage with communities? There are still various different ways in which this could be done. One is having a hotline be available so that the communities can know and interact with the National Society or the organization's staff and volunteers, get their questions answered. And also they could relay feedback as well on how we as humanitarian organizations can improve the way that we're providing assistance to them. In some cases where we wanted to send messages, I mean, we have heard of examples of using SMS to sending SMS messages to community members, making them aware of available assistance or programs, but also in some cases working with radios to broadcast specifically what the Red Cross or the Red Crescent might be doing. And again, providing a means for the community to provide feedback and contact the National Society are just some of the ways that we have seen done.
Great, thank you so much, Joseph. We have another question about fatigue. So with the technology, it can be easier now to carry out remote monitoring. At times in disasters, we tend to reach out to the same communities in our data collection. How are organizations collaborating together to ensure that data collection fatigue does not occur among certain communities? It's quite a good question because, of course, as you said, it is much easier to go ahead and do our data collection now. And of course, there are multiple organizations, sometimes in the same community, and the communities often do get quite fatigued. So I think that a mitigating way for organizations usually is to try to coordinate a little bit in terms of who is working in which area, and then also in terms of the data collection tools, really being mindful of the time it takes, and also listening to the feedback from respondents or affected persons when they do express either fatigue or dissatisfaction with the activity. Yes.
Yeah, maybe Shahnaaz, just to add, and I think you mentioned it already, it definitely relies really good coordination, and in some cases, particularly in the use of cash, we recommend, definitely identifying which actors are also providing cash and voucher assistance within communities, so that we could maximize the assistance being provided to those who need, versus having double targeting, for instance, within the various communities that also have needs. So there are cash working groups, for instance, that have been put in place or being put in place to try to address some of these. From an assessment perspective, there are also efforts to try to link up with other organizations to do multi-sectoral assessments led by maybe one agency, particularly if they have more resources than some of the other agencies or organizations that are not able to. But of course, there are organizations that have more access or more information about certain communities, because they are either from there or they have been catering to the needs of those communities longer or more so than some of the other organizations. And so, including them in some of these assessments effort and coordinating these efforts are definitely some of the key things that we have seen and trying to improve on as well.
Great, thank you so much, Joseph. Is there anyone else who'd like to make a remark on this?
Yes.
Great, go ahead, Filippo.
Thank you, Shahnaaz. No, I just want to add a couple of points. One is on the minimization of data collection, and unfortunately, we are seeing today that the data fever is somehow the victims of the data fevers of our organization are actually the people we interview, and I couldn't agree more that this for me is I couldn't agree more on the comment that this is actually I would say an abuse of the time of the people that provide sometimes to data to humanitarian organization, and sometimes without really a scope for that. On the other hand, there are benefits for panel surveys. So to interview the same people over time, that is what allow you to verify how the situation and the success of a program on those people has been felt. But I think we are shifting a bit towards the discussion towards remote monitoring. But let's remember that the session is about also the other stages of the remote project cycle. And one thing, for instance, that we're trying to do with this remote management of affected people is that we are also trying to get affected people who are not necessary beneficiaries enrolled into our programs in a way that we can support them with the safety nets in the moment that the shock occurs. I have to close because we are actually 1 minute to the end of the session, unfortunately. I think we can continue the discussion over emails, maybe, because we would love to hear from you. If you have any additional points or question for us, you have our contact details in the ALNAP event page. So feel free, please, to reach out to us for us to answer the question we couldn't answer today, or if you have additional comments or questions. And I'm sure myself, and I'm sure all the others will be happy to exchange with you on this initiative. Of course, just for you to manage expectation, we are still at the very early stage of finding the right answer, as you could see today. But what I can say on behalf of the ICRC, the IFRC, the Norwegian Red Cross, but also the wider Red Cross and Red Crescent movement, is that we recently received the support from Innovation Norway to further explore this very complex yet exciting challenge, and try to find a sustainable way to engage with beneficiaries remotely while maintaining proximity to the communities that we serve. And we would, of course, love to hear from different partners on how we can help each other on this common goal. So really, again, please feel free to reach out. One last thing, we will continue this discussion on this and other related topics at the ICRC Analysis and Evidence Week between November 29th and December 3rd. So for instance, there will be a session on anonymization and data protection, which I'm sure Scott will find relevant from his comments on the site. And you can find the link to the event. I'm going to put it in the chat now, and then the final agenda will be available on November 1st. Thank you again to all our panelists and all of you who joined us today. Have a great rest of the day and enjoy the other session of this event. Thank you very much.